In this video, we will explore the anatomy of the jugular system, a key network of veins that drain blood from the brain, face, and neck back to the heart. To do so, we will start with a brief introduction, followed by detailing the constituents of the jugular system that are the internal jugular veins, the external jugular veins, the anterior jugular veins, the posterior jugular veins. We will mention some clinical applications, and finally a conclusion to summarize all the key points. The jugular system plays a very important role. It ensures the venous drainage of most of the face, neck, and brain. Let's start by detailing the descriptive anatomy of the jugular system. The internal jugular system collects blood from the brain, part of the face, and the anterior region of the neck. The external jugular system drains the walls of the skull, the deep parts of the face, and the lateral and posterior regions of the neck. The internal jugular vein drains the brain, skull, face, and neck. The internal jugular vein emerges from the jugular foramen at the base of the skull. It passes between the mastoid process and the mandibular angle. It ends at the base of the neck, where it joins to form the brachiocephalic vein. The anatomical relations of the internal jugular vein are: at its superior portion, medially, it is related to the vagus nerve and the hypoglossal nerve, and it is located posterior to the external acoustic meatus. In the neck, the left internal jugular vein is more closely related to the arch of the thoracic duct. Medially, it is related to the common carotid artery, the internal carotid artery, and the vagus nerve. Laterally, it is crossed by the digastric muscle. Above the digastric muscle, it is related to the parotid gland, and below the omohyoid muscle, it is associated with the jugular lymph nodes. The tributaries of the internal jugular vein drain the tongue and the submandibular region. The facial vein originates at the medial angle of the eye, posterior to the facial artery. It follows the masseter muscle and the mandibular angle. It drains into the thyrolinguofacial trunk and drains the soft tissues of the face. Other tributaries include the pharyngeal veins, the superior thyroid veins, and the inferior thyroid veins. Moving on to the external jugular veins. Visible beneath the cervical skin, it drains the parotid gland, the scalp, the maxilla, and the neck. It travels superficial to the external surface of the sternocleidomastoid muscle and ends at the base of the neck, forming the brachiocephalic vein. Tributaries of the external jugular vein include the superficial temporal vein, the occipital vein, the posterior auricular vein, the transverse cervical vein, and the suprascapular veins. The anterior jugular vein is visible beneath the cervical skin. It drains the parotid gland, the scalp, the maxilla, and the neck. It runs superficial to the anterolateral surface of the sternocleidomastoid muscle. It ends at the base of the neck in the subclavian vein and receives the submental veins. The posterior jugular vein drains the posterior scalp. It originates from the suboccipital plexus and ends in the jugulo-subclavian venous confluence. Let's explore some clinical notes and applications, starting with the jugular venous distension. This refers to the visible swelling or engorgement of the external jugular vein in the neck, typically observed when the patient is in a semi-upright position. It is a key clinical sign of elevated central venous pressure and may indicate right-sided heart failure, where the heart struggles to pump blood effectively, causing venous backflow. Constrictive pericarditis, where the pericardium becomes thickened and limits cardiac filling. And large pericardial effusion, where fluid accumulation around the heart compresses the chambers and impedes venous return. Internal jugular vein catheterization is when a catheter is inserted into a large caliber vein in the neck, specifically the internal jugular vein. This is an invasive procedure that carries certain risks, including accidental arterial puncture, where the carotid artery is mistakenly punctured instead of the vein. Such a complication may lead to the formation of a hematoma, which can become infected or compress the carotid artery, potentially causing serious consequences. To conclude, the jugular venous system plays a crucial role in draining blood from the brain, face, and neck. Comprised of both deep, internal jugular, and superficial, external and anterior jugular, veins, it provides multiple pathways for venous return. Clinically, it is important not only for diagnostic observation, such as in jugular venous distension, but also for therapeutic access, like central venous catheterization.